Hi, this is Sandy Ridout, functional medicine consultant for SIBO Clinic Canada. I just wanted to take this opportunity to show you a direct link relationship from hypothyroidism, low thyroid hormone, to chronic severe belching. Now, I didn't know I was going there with it until I talked to the doctor and we figured this out. So I got a call from a doctor about 3.5 weeks ago from BC. So she asked if we did SIBO breath testing with patients from BC. And I said, well, of course we do. We do it actually all over Canada, the United States, and Europe. So she asked me about severe belching. Do we see a lot of belching in patients that are tested positive for SIBO? And I said, yes, but not always, because usually it's accommodated by other symptoms as well, such as bloat, stomach distension, and gas, and other health ailments that SIBO can lead to. And so I said, what is the major complaint? If you were to name 3, what is the major complaint? She goes, I really don't think she has any major complaints. She's just basically, she has some stress, but she's just doing a lot of burping. And I said, okay. So I thought about it and I said, stress, because this is kind of a systems-based way of thinking. Stress can shut down the digestive system, and so our food is not getting digested. Now, belching happens in the stomach, and then gas is expelled from the stomach through the mouth. Well, SIBO is different. SIBO is in the small intestine. Gas gets absorbed into the bloodstream and expelled through the lungs. So it's a little different. So severe belching only with SIBO, can it happen? I haven't seen it. Not to say it doesn't happen, but I haven't seen it. So it just didn't surprise me when she said she tested negative. So I said, so when was the last SIBO breath test that she had? She said it was about 7 or 8 weeks ago. And I said, okay, we don't want to test her for that. So we might want to look at other things, like low stomach acid. And she says, well, how's that related? She doesn't have the map, so I told her that she might want to get the map, and she can diagnose much more effectively. So the symptoms. So we're going to open up symptoms, and we're going to blow that up a little bit. We're going to go to eructation. Eructation is basically belching or burping. And when we open that up, we see other causes of belching. We open that up, we see SIFO, small intestinal fungal overgrowth. Well, again, we're dealing with belching from the stomach. And if there's no SIBO, doesn't mean there's no SIFO, but I wouldn't be looking at that right now, although it's good information. So you do an organic acids test to see if she has some metabolites that are released by the fungal overgrowth. But in this case, I'd be looking at what about the patient? Let's think about the patient. What's her lifestyle? So when she eats, does she eat fast? Does she chew well? Does she swallow air with her food and drink? Because this can all cause the belching. What about carbonated beverages? Does she drink a lot of pop? Hypochlorhydria, of course, is low stomach acid. Pancreatic enzyme insufficiency goes hand in hand with hypochlorhydria. Not all the time, but sometimes. Then, of course, there's food allergies. And then GI distresses. That should be diseases there. And there's no, I spelled that wrong. So when we open that up, we look at gastroparesis, we look at H. pylori and GERD. So I asked her, I said, is there any signs of acid reflux or any kind of infection? But I guess she's seen a gastroenterologist, and he or she ruled out any of that, any gastrointestinal distress. So I'd like to have a look at hypochlorhydria, and this is where the map comes in handy, because you click on that link and it goes right to hypochlorhydria. Signs and symptoms, and you can see up the top there, just coming down a little bit, it says bloating, stomach distension, belching, etc. So what we see with hypochlorhydria is gas being produced within the hour of the meal. Anything after 2 hours, we would be looking at problems in the small intestine with the release of digestive enzymes from the pancreas to be able to further break down your food. So hypochlorhydria could be a cause. I was looking at it as probably one of the major causes. So what causes hypochlorhydria? We have to look at that, because you just don't want to treat with hydrochloric acid and pancreatic enzymes without trying to figure out why the person has low stomach acid in the first place. And remember, hypochlorhydria, pancreatic enzyme insufficiency go hand in hand. Most of the time when there's low stomach acid, we don't get that signal from hormones to be able to tell the pancreas and the gallbladder, for example, to release what they need to release to be able to digest the food, because our whole digestive system is shut down. So if we look at potential causes of hypochlorhydria, we look at physical, chemical, emotional stress. This is also infections, pathogenic infections that stress the body out. Stress shuts down the digestive system. It doesn't have to be just emotional. It could be any kind of stress. It could be an injury. It could be exposure to chemicals, etc. Gastritis, H. pylori infection, these were pretty much ruled out. She's in her mid-40s, so aging is not a big thing. I'm not aware that she does cannabis, neither does the doctor. Zinc and thiamine deficiency should be a B6 as well, so she could have insufficiencies of the cofactors, which are the nutrients needed to make the hydrochloric acid. But I had a sneaking suspicion that it's hypothyroidism. Now, lack of sufficient protein in the diet, but she's a meat eater, I found out, so that wouldn't be the case, because protein stimulates the secretion of hydrochloric acid from the parietal cells in the stomach. So if we look at it and we think, okay, hypothyroidism, how can that cause low thyroid hormone? How can that cause hypochlorhydria, which leads to the belching? Well, if we click on that link, hypothyroidism reduces the production of hydrochloric acid. And so over on the right-hand side, it tells you about it. So I was explaining this to her. I gave her the map for 4 days to have a look at it. She found it quite detailed and kind of difficult to navigate, but I showed her how to navigate what we're doing here, and this is very, very simple. So that's the linkage to SIBO, but it's a linkage to gastrointestinal impacts. So it reduces the production of hydrochloric acid. So when we look at hypothyroidism, what are the causes of hypothyroidism? We have to go further. We have to find out why. Now, just because you're TSH, this is a whole other ballgame, and this is what I'm going to talk about in the future. But TSH, thyroid stimulating hormone, is a poor indicator of thyroid disorder. And the free T3, free T4, the same thing. Why? Because it's in the blood. And only 18% of thyroid hormone is in the blood. We need to get it inside the cells. So we have to measure for intracellular T3. We do that here in Moncton at our clinic. So if we look at potential causes of hypothyroidism, we can open that up. We can look at medications that inhibit TSH. Intracellular hypothyroidism, which I just mentioned. So nutritional deficiencies, yes, there could be a nutritional deficiency, an iodine deficiency, selenium deficiency. We need to know these things. Protein deficiency, vitamin D deficiency, hormonal imbalances, thyroid hormone resistance, high estrogen levels. And there's reasons behind this. And if you keep on opening up all of these little bubbles, it explains why. So there's many things that could lead to it, type 2 diabetes. So you got to ask these questions. What else does the patient present with in terms of signs and symptoms, but what other diagnosis has been made on them that could be causing the hypothyroidism, causing low stomach acid, causing the severe belching? So sometimes a lot of practitioners, all health professionals, can actually go down the wrong road because they don't really have a strong understanding of basic physiology. So I wanted to share that with you today. So if you are going to your doctor to try to find out why you're burping all the time, he or she tells you to take digestive enzymes, maybe. The naturopath will tell you to do that, plus nutritional deficiencies, tell you to take a bunch of this and a bunch of that. But hey, why don't we get to the root cause? What's causing it? So it could be just the fact that you're not breaking down your food well enough when you're chewing because you're on the go. And we're all kind of guilty of that because our lives are so busy. But really we have to take the time to liquefy our food so we can almost drink it type of thing. So very, very important to chew your food well. Very important to relax and digest as opposed to fight or flight because you're not digesting your food. Can it cause belching? Absolutely. So there's so many factors. It's just not SIBO. Thanks for listening. Make any comments or ask any questions, and we'll get back to you as soon as we can. Thank you.